Okay, in this video, I'm going to be doing an IV change continuous to intermittent saline infusion lock, plus IV push medication and a DC of the IV. So to start, I'm going to prepare and administer medications based off of the 6 medication administration rights. So right patient, right drug, right dose, right route, right time, and right documentation. I am going to do hand hygiene. I'm going to make sure my patient's safe, make sure I'm safe, make sure I give privacy to my patient, and I'm going to make sure that I have good body mechanics throughout the whole procedure. I'm going to check the MD order in the MAR. So it looks like we're going to be doing a saline lock IV after second liter of 0.9% of normal saline. I just touched my nose, so I would wash my hands again. So we're going to be taking off now that the IV infusion is finished, we'll be taking it off and leaving it as just the IV saline lock. So I'm going to wash my hands. Again, I'm going to put on gloves. I'm currently out of gloves, so pretend I have gloves on. And I'm going to assess the site, make sure there's no redness or any problems with it, check the patency of it. And then, I'm going to lift up on the tape. I'm gonna grab a gauze. I don't have gauze pads, but I have gauze sponges. So I'm gonna put the gauze underneath the hub. I'm gonna make sure that I clamp my fluids, and my fluids are clamped. And I'll remove any tape, get the tape loosened up, and then I will go ahead and remove the tubing from the saline lock. I'm gonna put this over here. Okay, and now I'm gonna get an alcohol. Oops. I'm gonna clean the port vigorously with an alcohol swab. Okay, and then I'm gonna get my saline flush, and I'll flush it. Well, 5 milliliters of the flush. I'm not gonna actually do it, but I would. So then after that, I would take this off and discard it. Okay, and then I would teach the patient how to maintain the lock. Like try not to move it around so much, don't hit it on anything. If anything looks like it's wrong with it, get the nurse in here and we'll get it fixed. And then I'm gonna document everything in my nurse's notes and my MAR. What I did, when the infusion stopped, how much was the infusion, the assessment of the whole thing, I would document. Okay, and then after I'm done, I would discard all of my materials here. Okay, and then I would come back in and if I left, and then I would perform hand hygiene again, and then do my, my administration. I would also, make sure that the patient has privacy, that they're safe, I'm safe, and then make sure that I'm using good body mechanics. And then, so when we come in, we're gonna check the MAR, and we're gonna see what's gonna be administered. So we're gonna give Dilaudid 2 milligrams IVSP every 2 hours as needed for complaint of pain. Dilaudid label states Dilaudid 2 milligrams per milliliter and dilute with 2 milliliters of normal saline for IV administration. Give Dilaudid 1 milligram every 2 minutes per IVSP. Okay, so we're gonna give that IV push. So since it's 2 milligrams per milliliter and we're giving 2 milligrams, we're just gonna give 1 milliliter, but we need to dilute it with 2 milliliters of saline. So we're gonna have 3 milliliters total, is what my calculation was. And then, 1 milligram every 2 minutes, but since we're going to dilute it it's going to be 3, so we're going to do 6, every 2 minutes, 1 milligram every 2 minutes. So we're going to do 6 minutes of pushing it. Did I have that right? 2 milliliters, 1 milligram every 2 minutes, and we're gonna have 3 milligrams. No, we're gonna have 3 milliliters, excuse me. We're gonna have 2 milligrams. So we only have to infuse it over 2 minutes because 1 milligram for every 2 minutes, and there's 2 milligrams. So we're gonna do it for 4 minutes. Okay, got that covered. Okay, so we determined the rate. So now we're going to, I washed my hands and I have gloves on. We're going to clean the port. Clean it good. And then I'm gonna get my IV flush here. And we would give 5 milliliters before and 5 milliliters after. So I'm gonna give 5 milliliters, give 5 milliliters, and then we would give 5 after. So for now, we're going to do the medications here. So this is going to be my saline, and this is going to be my Dilaudid. So we're gonna get my needle, and we're gonna get our alcohol swabs, and we're going to clean the vials. About 15 seconds. And then for the other one, let those dry. So for the Dilaudid, we're going to need 1 milliliter. So we're going to drop up 1 of air. And we're going to put in. And then we're going to drop 1 milliliter of Dilaudid. Get rid of any air bubbles. Okay. Okay, and then this would be considered a one-time use vial of saline. So then we could put it in, and then we would draw up 2 milliliters of the saline. So then we'd have 3 milliliters of medication. And then I would dispose if this is a one-time use. If it wasn't a one-time use vial, then I would change my needles in between that. So I'm going to recap my needle using the scoop method. I'll take this off. And so I cleaned my port and I flushed it with 5 milliliters of saline. So now I'm going to take my medication and I'm going to attach it to the port. And then so 1 milligram per 2 minutes. So we have 2 milligrams, so we're gonna go for 4 minutes. No, what did I say? We have 2 milligrams, so 2 minutes every milligram. So we're gonna go for 4 minutes, yes. So I would wanna time myself, you know, pushing the medication for 4 minutes and making sure that I'm going slow enough to keep it at the 4 minutes. I'm not actually gonna inject it, but I would do that. And then I would take off that after I'm done, and then I would flush it with 5 milliliters of saline. Flush it with 5 milliliters of saline. And then I would want to assess how the patient responded to the medication, and I would want to assess the site again, make sure there's nothing wrong with the site, make sure the patient's reacting well to the medication, and then I would document the type of medication to give, I would get how long, how much, and then document how the patient tolerated it. And then also just document the IV site as well, just to be safe. So there we go.